ears. Okay. Hi, my name is Morgan Morris. I'm a nurse practitioner student at Auburn University, and we're going to do a head-to-toe assessment today. This is my patient. Can you tell me your name?
Elizabeth Calhoun.
And where are we right now?
We're at Tallahassee Memorial Hospital.
What year is it?
2023.
And our president?
Joe Biden.
Perfect. So Liz is alert and oriented times 4. She appears healthy and in good spirits. No signs of distress today. She came in here with a steady gait, moving all 4 extremities. Her speech is clear, coherent. Her skin is warm and dry, normal for her ethnicity. And we will go down to her fingers. And there is no clubbing or cyanosis. Cap refill is less than 3 seconds. She does have a pretty nail color on right now, so I'm not going to be able to see if there is any ridges or anything like that, but we would check for that. Skin turgor, there is no tinting, so that is good. Then we'll go on to your head. So I will feel, so her head is normocephalic. There are no indentions. Her hair is thick and evenly distributed. There is no lice or infestations. No lumps or anything like that. So now we're going on down to your sinuses. So I'm going to palpate. Any pain?
No, ma'am.
Okay, percuss. Still good?
Perfect.
All right, so frontal and maxillary sinuses are non-tender. Can you smile for me? Frown. Puff out your cheeks. Raise your eyebrows. Close your eyes. And raise. Perfect. So cranial nerve 7 is intact. Check your T and J. Can you open and close? A little pop on this side, it feels like. Was there any pain?
Okay.
Good. And clench for me. Perfect. So part of cranial nerve is intact. Close your eyes. And tell me if this is dull or sharp.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Perfect. So cranial nerve 5 is intact. Now we will palpate your lymph nodes. All right, so pre-auricular, post-auricular, anterior cervical, posterior cervical, tonsillar, submandibular, submental, supraclavicular, and infraclavicular. Any pain there?
No, ma'am.
Perfect. And all of those were not swollen and yep. Okay, so now we will go to your eyes. Okay. They are brown, and you say your contacts, is that correct?
Yes,
okay.
ma'am.
So your conjunctiva is white. I'll pull this down. Sclera is pink and moist. Lacrimal gland, how does that feel? Does that hurt?
Nope.
Perfect. So that is non-tender. And now we're going to move on to our Snellen chart. So I'm not going to have you take your contacts out, but hold this about 12 inches from your face and read the lowest line that you can.
LTFPH.
Perfect. So with your contacts, 20/20 vision. Excuse me. Bless you. So that is perfect. And so now we are going to check in your eye with a light. So the first is a corneal light reflection. Look here. Perfect. So direct light reflects visible nasal to pupil bilaterally. And now we're going to look at the structures of your eye. All right. So that looks good. The anatomy was visualized. The optic disc is round, yellowish in color and defined. The retinal background did not have any hemorrhages or exudates, and we could see the macula and fovea centralis. So while we're doing this, just look straight, check your pupils. Perfect. So cranial nerve 3 is intact. Her pupils are equal, round, reactive to light. They're about 3 millimeters, and they do accommodate. And we'll do the points of gaze. Now just follow my finger and don't move your head. Perfect. So 3, 4, and 6 is also intact. Now we're going to do the cover test. So cover an eye. All right, and then uncover. Perfect. Now the other one. Uncover. Perfect. So there was no lateral movement or nystagmus there. So that was good. So now we are going to do the confrontation. So cover your left eye. And I'm going to cover mine. You tell me when you see my hand, okay?
No.
Perfect. Now the other side.
No.
Good deal. So no deficits there. All visual fields are intact. So now we are going to inspect your ears. Could you pull your hair back for me a little bit?
Ma'am.
Perfect. So they are symmetrical. They are not red. There is no drainage. Is any tenderness here?
No, ma'am.
Perfect. So they are non-tender. I'm going to whisper something and you tell me if you or repeat what I'm saying.
Cat.
Perfect. So that is good. Hearing sounds good. And we are going to, now we're going to take a peek. All right, we're going to go this side first. All right, that looks good. Perfect. So a little bit of honey-colored cerumen in there. The tympanic membrane is pearly and white. The cone of light was seen at around 5 o'clock. And now we will go into the Weber and Rhine test. All right, so tell me if you can hear this on both sides, okay?
Yes.
Perfect. So now we're going to do the Weber. So I'm going to place this behind your ear.
Yes.
All right, now tell me when it stops. Stop. Okay. And what about now? Stop. Perfect. So air conduction was longer than bone conduction, which is normal. So cranial nerve 8 was intact. So now we're going to look at your nose.
Right.
It is symmetrical. It is not red. Any tenderness?
No, ma'am.
Perfect. So the nose looks good. Can you cover one side?
Yes.
Breathe in, and then the other. Perfect. So patent on both sides. Now we're going to look in your nose.
Okay.
I don't want to get you. Okay. So her nose on the inside is pink. I did not see any drainage. She does have a little nose ring, but it did not look red or infected or anything like that. No nasal polyps or swelling, and her septum was midline. Now, can you close your eyes?
Yes, ma'am.
And tell me what you smell.
Alcohol.
Perfect. So cranial nerve 1 is intact. So now we will go down to your lips. They are moist, and there's no cracking or edema. They're pink. And open your mouth for me. All right, so mucosa is pink. Tongue is pink. Now say ah.
Ah.
Perfect. So uvula does rise when she says ah. There does not seem to be any dental caries or missing teeth, Invisalign
Yes.
in, so that's great. There is, the pharynx is not red. There is no exudate or swelling. Her tonsils were present and also not swollen. Can you stick your tongue out and move it side to side? Perfect. So that is cranial nerve 12. It is intact. And then can you swallow? Good. So that is part of cranial nerve 10. We would also check her gag reflex with a tongue depressor, but I'm going to spare her that for this video. And then the uvula rising, that was also cranial nerve 9. So now we will go down to your neck. We're going to inspect. It looks symmetrical. There's no redness or scars or lesions. Any tenderness?
No, ma'am.
Good. So can you do chin to chest, all the way back, and then ear to shoulder on both sides? Any pain?
No, ma'am.
Good. So full range of motion. I'm going to feel your pulse. All right. So strong carotid on bilaterally. And can you shrug? Good. So shrugging shoulders and turn against my hand. And this side. Perfect. So cranial nerve 11 is intact. And now can you turn this way for me a little bit? I'm going to check your thyroid.
Okay.
Can you swallow? Perfect. So her thyroid did rise when she swallowed. There did not seem to be any goiters or anything like that. Her trachea is midline with no deviation. And is there any tenderness?
No, ma'am.
Good. All right. Sorry.
Bless you.
Thank you. Okay, so now we are going to come down your chest. She does not seem to be in any respiratory distress, not using any accessory muscles. Looks to be regular rate and rhythm and depth. So we are going to listen. So can you turn
Yes, ma'am.
this way for me? All right, so we will inspect first. Typically, we would have the patient's back exposed, but we're not going to have that for this video. So first, I will check lung expansion. Can you take a deep breath and out? So that is symmetrical bilaterally. And then we will palpate. Is there any tenderness?
Oh, ma'am.
Perfect. No abnormalities felt in her ribs, and no crepitus. So now, will you say 99?
99.
Again?
99. 99.
Perfect. So no fremitus noted. While we're back here, we're going to go ahead and check CVA tenderness. I'm going to percuss your kidneys. Any pain?
No, ma'am.
Perfect. And then, so I'm going to raise your arm. So AP lateral appears to be 2 to 1, which is normal. Oh, you can move it back down.
Okay.
Thank you. And so now we are going to percuss apex to base. And you would do this bilaterally. I'll do it one side for the video. All right. So that sounds good. And now we will auscultate. And again, we would do this bilaterally. Perfect. So lung sounds were clear and equal. So now turn to the front for me. So we're gonna inspect, look symmetrical. There's no deformities. Any pain?
No, ma'am.
No pain. So now we're gonna also percuss again, and we would do this bilaterally all the way down, and then I will auscultate. Great. Her lung sounds are clear. No adventitious breath sounds heard. So now we will go into the breast exam. And again, we are not going to expose our patient for this. So sitting upright, just raise your arms up. All right, so they seem to be symmetrical. We would assume no dimpling. And then you can put them back down.
They're just small.
That's all right.
Yeah.
Everyone's made different.
Yeah.
Okay, so now we're going to lay down.
All right.
And we're going to kind of walk through a self breast exam, and I'm going to palpate a little bit.
Okay.
So you would do your armpit and feel for any swollen lymph nodes there and the tail of Spence. And then you would go back and forth in a curvy motion all the way down to your nipple, all the way around, and feel for any swollen lymph nodes or anything like that. I did not feel anything with our palpation. All right, turn it back down. Thank you. So now we will go to cardiovascular, and let me raise just a little bit more. There we go. All right, so we are going to inspect first. And just rest here. Let me fix your pillow. Oh,
Thank you.
rest your head back.
Thank you.
So no JVD noted here. She looks comfortable. We'll palpate your chest. Doesn't seem to be any heaves or thrills noted. And so now we will auscultate, and we would listen with the bell and the diaphragm, but I'm just going to do with the bell for now. apical point, Erb's point, tricuspid, and mitral. All right. So regular rate and rhythm. S1 and S2 were heard, and we're also just going to palpate for PMI here. And that is a regular rate and rhythm as well. So now we will listen to your carotid.
Okay.
And we would do this bilaterally. And I'll go ahead and listen to the temporal. And that would also be bilaterally. So no bruits heard there. And we will now go down to your abdomen. Okay, so we are also not going to expose her abdomen for the sake of this video, but I'm going to lay you back a little bit flatter. Okay. All right, so inspection. It looks symmetrical on both sides. It is flat. Now we will listen to all 4 quadrants. And during inspection, you want to make sure that there is no redness or deformities and that the umbilicus is midline. So listen. So normoactive vowel sounds, you would typically hear about 20 per minute in each quadrant. You would listen with the belt and the diaphragm here. And let me listen to the aortic, renal, iliac, and femoral arteries as well. And all of those sound good. No bruits were heard. So now we will percuss in all 4. Any tenderness?
No, ma'am.
Great. So there was tympany throughout, and then we will come down. And then dullness heard over her liver. And then we would measure from here to the rib, and it should be about 7 centimeters in a female. Here we would also check for the femoral and inguinal nodes since we are moving down, but we are not going to do that for the sake of this video, but they would be non-tender and mobile. So we will now go to palpation. Are you having any stomach pain?
No, ma'am.
Okay. So we're going to do soft palpation and then deeper, okay?
Okay.
Just tell me if it hurts.
Okay.
Are all good?
All good.
Good. So the soft palpation, I didn't feel any abnormalities there, and so now we'll go deeper. Okay. So everything felt good. There was no abnormalities noted, no pain.
No pain.
Perfect. And then we will take a deep breath for me. All right, and one more. Perfect. So we were able to palpate the liver and the spleen. They were non-palpable. We palpated for them, is what I meant. So, and any pain with all of that?
No, ma'am.
All right. So again, no pain. Now we will move on to musculoskeletal. So let's sit up.
Okay.
Yeah.
Thank you.
Okay. So I'm going to start. Let's just go ahead and do your pulses.
Okay.
All right. So radial is good. Popliteal. Right. Posterior tibial and dorsalis pedis. All right, all of those were 2+ and strong. Her skin again is warm and dry. So now let's do your range of motion. So we already checked your neck. That was great. So let's do your shoulders.
Okay.
So any pain?
Nope.
No? Okay. So again, we would have her in a gown, so we would be able to see if there's any redness. But there doesn't seem to be any abnormalities in her shoulder with palpation. Now, can you raise your arm up and down and then back? Okay, and then back forwards and then go out and in. Perfect. So no crepitus was noted there. And we would be doing these bilaterally. So then raise your arm like this, bent.
Okay.
Perfect. Straighten. Any pain?
Nope.
Good. All right, now push and pull. Good. So that's 5 out of 5 strength. And again, bilaterally. So let's go down to your wrist. Actually stick your arms back out and in and out. Perfect. So that's good. Range of motion is good. And then for your wrist, go down, up, and around. And then your fingers. Perfect. Can you squeeze? Perfect. And then push me away, and then I'll pull back. Okay, so 5 out of 5 strength. And then we will go to your knees. So doesn't seem to be any redness here, no swelling, nothing is palpable. Can you straighten?
Yes.
And bend back? All right, now push against me. Perfect. So 5 out of 5 strength and good range of motion there. We would do that bilaterally. And lay back. I'm going to do your ankles. All right, so ankles feel good. Can you back, forward, and then move your foot around? Any pain?
No, ma'am.
Good. And no crepitus was noted there. Can you spread your toes? Perfect. Now for your hips, let's bring your knee up to your chest. There you go. And down. And then bring it up. And then we'll go to the side. And then in. Good. Any pain?
Nope.
Good. So 5 out of 5. Or pull up against me. Good. 5 out of 5 strength and full range of motion in the hips. And again, we would do this bilaterally. So next, let's go to your reflexes. Robbie, sit back up.
All right.
All right, I'm gonna pull your sleeve up here. So we're gonna do your bicep.
Okay.
Perfect. And then tricep. Found the right way to hold you here.
Yeah.
Brachioradialis. Okay. And then we will come down to your knee. Achilles. Sensitive. And then we will do Babinski. And that was negative. So all of her reflexes were good. And then Babinski was negative. So let's stand up. And I'm going to check your back.
All right.
So I'm going to check your spine now. So if you can, just bend forwards for me. Perfect. So feeling down her spine, it is midline. There doesn't seem to be any curvature, so her scoliosis screen would be negative. And now come all the way back.
Okay.
Like, yep.
Okay.
And then side to side. And then twist. Any pain?
No pain.
No? I heard some popping.
I know. I'm all cracky.
All right, you can have a seat. That
Yes,
was
ma'am.
good. So your range of motion in your spine is good too. So now we will go to your nervous system, and we had checked your orientation when you got here, and it was ANO times 4. There doesn't seem to be any cognitive impairment. She's following all of our commands today. And for your memory, what did you eat for breakfast?
I ate oatmeal.
Okay, good. And where did you go on vacation last year?
Last year I went to Orlando.
Perfect. So recent and remote memory are intact. And now we will check, close your eyes for me. So stereogenesis, can you open your hand and tell me what object this is?
Sunglasses.
Perfect. So that is correct. And while your eyes are still closed, we're going to do check graphesthesia here, and just tell me what I draw on your hand.
3.
Perfect. Number 3. So that is intact. You can open your eyes now.
Right.
So now we were going to check your motor function. Touch your nose and then my finger. Fast as you can. Perfect. And then can you take this foot, this heel, and bring it down your shin? and up. Perfect. So her motor function is intact. And stand up for me. And then do heel to toe, just a few steps. No, like this.
Oh, gotcha.
Heel to toe. Yeah. Perfect. So her gait is steady. And then close your eyes. Just stand still. Perfect. So you can have a seat. And that was a negative Romberg test. She is well balanced. And that almost concludes our video.
Okay.
We got one more thing to do.
Yes,
So close your eyes for me.
All right.
And tell me if this is soft or sharp.
Soft. Sharp. Soft. Sharp.
Perfect. So sensation is intact as well. And that concludes our video. Thank
you,
you.
Ms. Morgan. I
Thank
appreciate you.